I can't tell you what great pleasure it gives me to say, welcome to the state capitol, single-payer warriors. And you look fabulous. This is an important day. This is the fourth time now, that this bill has been introduced in recent years, and of course it's appropriate at this moment to tip our hat and express our thanks to my predecessor author, Senator Sheila Kuehl, for her victories in 2006 and 2008. Of course, we reintroduced it in 2010, had success in the Senate, through the Senate Health Committee, through the Senate Appropriations Committee, and off the Senate floor. Unfortunately, we didn't have similar success in the Assembly, but that's history. We're back again, and with your support and the growing waves of numbers of Californians who get the wisdom and the cost benefit and the health care provision of Medicare for all, I'm confident that we'll have success in the Health Committee today. It's been a real educational experience for me as chair of the Senate Budget Committee this year. We know from LAO reports that we have approximately a $20 billion chronic structural imbalance in our state budget, meaning we have expenditures that exceed expected revenues next year, the year after that. We also know that about a third of our state budget is comprised one way or the other in direct payments such as Medicaid, through federal direction of monies for health care programs, or for our own costs in providing premium coverage for state employees. A third of our state budget reflects health care costs. It's in everything. It's in transportation, it's in education, it's in every aspect of state government. We also know from a study at Boston University that about a half of our health care dollar is squandered on both administrative and clinical waste. Half of our health care dollar, about 30% in wasted administration, about 20% in clinical waste. A third of approximately $86 billion budget, we're pushing $28 billion in health care costs to the state of California's general fund. 50% of that is $14 billion. With a chronic $20 billion structural imbalance in our budget, we cannot afford or sustain wasting $14 billion unnecessarily on health care costs. We're very proud that California was the very first state to place a single-payer health care reform bill on our governor's desk. Thanks to Sheila's leadership and your support, we did that once, we did that twice. We're so glad to see that the state of Vermont is now moving forward. They did a study, and their study revealed the best way to resolve their health care problems in the state of Vermont was with a plan very similar to what we have in SB 810. That's going to go to their governor's desk. And their senators are advocating in the U.S. Senate to move up the affordable health care allowance for federal waivers from 2017 up to 2014 so they can implement it in the state of Vermont sooner rather than later. So we want to join Vermont and take leadership once again here in California, and that's what we're here for today. There are so many people to thank, and I told Sheila, I remember I was chair of the Assembly Appropriations Committee the year that she brought it to our committee before getting it to the governor's desk. I think that was 2008. I said, this is not just a bill, Senator Kuehl. This is the fastest growing social movement in the state of California today. And it is just that. It's a social movement. And I want to thank our nurses, and I want to thank our teachers, and I want to thank our state employees, and I want to thank all of the physician groups, all of the advocates. I want to thank our retired Americans. I want to thank all of the folks who make this movement so powerful and so successful. So, We have a lot of education to do, a lot of consciousness raising to do. And I'm going to be talking about this in committee today because I think all the colleagues on our health committee understand what is in our bill. We've discussed this for many, many years now, but there will be questions raised. How does this interact with the federal health care reform? Does this conflict in any way? What were the president's comments relative to what states could do? All of it is supportive, of course, but we need to recognize that if that waiver allowance is 2017, we have a lot of work yet to do before then. And that's why we're moving the bill forward now. That's why it's critical to get out to Health Committee today and move this through the Senate and to the Assembly to the governor's desk. We know we will have to fight this at the ballot. Every major change in California is decided by the voters, whether it's through the referendum process, once we get a governor's signature and the industry tries to overturn it, we'll face the voters. Of course, this is just the policy piece. There's also the finance piece, which we cannot move successfully legislatively because that takes a 2/3 majority vote. We recognize we do not have it. We have to proactively take that to the voters. This will take years of work. Along the way, with greater attention to the issue, educating more Californians what single payer is and what it is not. Even Governor Schwarzenegger didn't know what it was when he vetoed it. Poor Governor Schwarzenegger. He said, Sheila Kuehl, I cannot sign your bill because it is socialized medicine. It is not socialized medicine, Governor Schwarzenegger. It's a public-private partnership, the kinds of public-private partnerships you advocated for so many years. Publicly financed, privately provided health care. Your doctor does not change. Your clinic does not change. Your hospital does not change. What changes is how efficiently we pay for it. I know you know that. Thank you for being here today. I know we've got more folks coming today that will be there for our committee hearing. And of course, we're going to be very respectful in the committee hearing room. We just want to air some of the new questions that will be raised as a result of the success of health care reform in Washington. But I think you know, and I know, that takes us a great step forward. It's the beginning. It is not the end of this debate. We will have single-payer health care reform in California. Thank you for being here.